Nation, thank you so much for watching. This is your number one TV station that builds your faith in Jesus Christ. Welcome once again to Health, Hygiene and Wellness. My name is Barasa Saenyi. Today in our program we have Dr. Silas. Today we are going to discuss about hypertension, how we can handle it and how to manage it for the people that have it. So without wasting so much time, I would like to welcome him right now as we discuss about hypertension. In this episode, what you expect is to know much about the heartbeat, the pulse, the heart rate, pressure, blood pressure, and when to know when the blood pressure is okay and when it's not okay, or when it's you're failing, and how you can handle it. All that is coming in this episode, so stay tuned till the end of the episode. Karibu sana daktari.
Asante.
You good?
I'm good.
It's been a while.
Yeah, it's been a while, but we thank God. I'm glad that we are going on well.
Yes.
We thank God.
Aha.
Yeah.
Welcome to this episode. I know you're an expert on hypertension.
Yes.
That is your field.
Yeah, that's my area of specialization. That is like bread and butter of every day. The patients I see every day are for hypertension and diabetes mostly. But we are expanding the program. We are currently handling asthma patients, chronic ulcer patients,
Yes.
and even arthritis and many other chronic diseases, even some early stages of cancer.
Yes.
They are still falling in my scope. So all chronic diseases actually, mimi husema mimi ni daktari ya wazee, because these chronic diseases usually affect the old people. So you find that most of the time I tend to see the old people more, but that does not mean that the young people don't suffer. These conditions can affect even the young people, though the numbers for the young people are very few. Yeah.
Before maybe we dive in to understand or maybe give us the definition of what hypertension is, maybe you can begin by differentiating between pulse, the heartbeat, and blood pressure, the three.
Okay. Thank you. So maybe I just define what blood pressure is.
Yes.
Blood pressure is the amount of pressure exerted on the arteries when the heart beats. You understand?
Yes.
So when the heart beats, maybe there is an amount of blood that the heart ejects that goes into the arteries to circulate nutrients and oxygen, and also to bring back the deoxygenated blood, and we call it the dirty blood.
Yes.
So that is the blood pressure. That's why you will see us measuring it from here. But for the pulse, it's the heartbeat. So you're just counting the number of beats per minute. When we were in primary school, there was that question in science that how many beats does a human being have in a minute? I remember it was in class 6.
Yes.
I used to love science. I always remember everything that we learned in every class.
Yes.
So the beats per minute, like we are being told, it is 70 beats or 72 beats. 72 beats per minute.
Yes.
Yeah. So that is the heartbeat, the number of beats the heart is doing every minute. So there is normally a normal range for that. Yeah. So for example, for blood pressure, they are measured in terms of numerator and denominator. So normally the upper reading is from around, let me not mess it up, but it's around, the lower reading is around 60 to 90, then the upper reading is around 90 to 120. Yeah, that is the upper reading. So if a patient comes to you and their blood pressure is above 120 over maybe 90, maybe I usually use 140 over 90, that is hypertension. So if a patient is having a diastolic, the lower reading should be 60 to 90. Then 60 to 90. Then if a patient is coming to you and they have a blood pressure of more than 90, the lower reading, that is hypertension. Then if a patient is coming to you with a blood pressure reading above 140, then that is actually hypertension. Yeah.
That makes the difference between pulse, heartbeat,
and the heartbeat is supposed to be the heartbeat actually is supposed to be not more than 90. Yeah, it's also around 60 to 90. The heartbeat, the pulse. The heartbeat is the pulse. We call it the pulse in medical terms, and maybe in a layman's language we call it the heartbeat. Yeah.
So the same amount of heartbeat that you can feel it from your chest is the same one that you can feel it from either your what do you call this? The biceps.
Yes, yes. Because you know, a heartbeat is a sound, and sound, when it's transmitted, it moves through liquid. It can move through. That's science. You remember that?
Yes.
It can move through air. Yes. So we believe that if the heart is beating and is producing a certain sound, it can actually move all the way to your arm, even to your legs, the lower limbs. So you can check. There are several points where you can check your heartbeat. You can check it from here. What we usually do normally for if you want to confirm if somebody has lost their life, because this is the last beat that goes. These ones can go and come back. If you cannot predict that somebody has lost their life by using this, we call it the radio pulses. You cannot use these ones, but actually you can use the pulses from your neck to determine if somebody has lost their life. The other point we can check your heartbeat is from here at the inguinal region. Then we can also check it from the popliteal region. We can also check it from the pedal region, just above your feet. So those are the areas we can check your heartbeat. And even in the armpits, some people you can feel their heartbeats in the armpits. So everywhere, anywhere that an artery passes, you are able to check the heartbeat. So the heartbeat is very important. Maybe just because you have asked, I can explain. The heartbeat helps us to understand the health status of a human being. For example, in children, when they are very sick, a doctor will know by using the pulse, because children don't communicate that they are sick. But you can use the pulse to know if they are sick or not. People who have heart failure, sometimes they have an irregular pulse, so your heartbeat inakuja, inapotea, inakuja, inapotea. So those are the people who may be having heart failure. And very, very sick patients, sometimes if you want to see if a patient is progressing well when they are admitted in the wards, usually use the heartbeat. That's why you'll see most doctors, when you tell them you are sick, the first thing when they greet you, they move their hands to the pulse to see if you are very sick or not. You can even use that pulse to determine if you'll admit this patient or not. So those are the things that we usually look at in terms of the heartbeat. Then for blood pressure, I think that we are going to discuss it today.
Now, we are talking about hypertension, which basically means is high blood pressure. What about the low blood pressure now? The opposite of it. We can begin from there.
A good question. So low blood pressure means your blood pressure is very low, beyond the normal. So I've said the upper readings should be 90 to 120, then the lower readings should be 60 to 90. So that's what I'm talking about, an adult population. Remember that. But for the young population, these adolescents, they have their own readings. You cannot say an adolescent needs to have a blood pressure
of 90 to
120. No. We have young girls who are going through menses, and they come with a very low blood pressure of even 56, and we tell them they are normal because they are still young, even children. So that reading is for the population that we are interested in, that are likely to get hypertension. So for low blood pressure, it means your blood pressure is below 60, the lower reading, and the upper reading is below 90. So some of the causes might be anemia, somebody who has had dehydration, if somebody has an accident and they bleed excess, so there is low blood volume, so probably because of dehydration and shock. If a patient is in shock, their blood pressure is very low. So those are some of the causes. Plus some are drug induced. There are people who may take an overdose of the hypertension medicines and they get a low blood pressure. So those are the things we look at mostly, and we believe they can cause low blood pressure. Plus even stress, even hunger, sometimes can cause low blood pressure, because you might develop what we call low blood sugar, and you develop low blood pressure.
Is it risky having a low blood pressure?
Definitely. It is even more risky than high blood pressure. You know, high blood pressure, you can live with it for years without knowing. But low blood pressure, you cannot live with it for days. Low blood pressure, in fact, with low blood pressure, you can only live with it for hours before it gives you symptoms. Because if you have low blood pressure, it means your brain is not getting enough blood at a go. So it will give you symptoms, and probably if you don't work on it in time, you may lose consciousness, you may get into coma and lose your life. Yeah.
Now, let's go to the opposite of it, the high blood pressure now.
Yeah, no. Now, for high blood pressure, a patient will come to you with very high readings. For example, blood pressure of more than 140 over 90. So it doesn't matter. You know, there are people who usually say that yangu ile ya juu ndio inapandanga sana, ya chini haipandi. So wengine wanasema ile ya chini ndio inapandanga na si mbaya. So whichever, if a patient comes to you with a blood pressure of let's say 150 over 80, I've said it should be 140 and above, 90 and above. But if a patient is coming to you with a blood pressure of 150 over 80, they still have hypertension because the upper reading is beyond the limit. Same applies to if a patient comes to you with a blood pressure of 100, that is the diastolic is 100, and the systolic is maybe, let's say 150. So probably this is a patient who has hypertension, and this is a patient you need to manage. So hypertension is persistent blood pressure, and I want to continue explaining that by saying that people need to understand high blood pressure is not stress. You know, people usually say that I don't have stress, so I don't have hypertension. So people say I'm not old, I'm not rich, I'm not obese, I don't have hypertension. Hypertension can come no matter what, no matter your age, no matter your weight, no matter your status, no matter whether you are rich or poor, no matter whether you are sick or not, no matter whether you have stress or not, hypertension can just come. So the moment the doctor tells you you have high blood pressure, it is a time that you need to take the key steps in managing your blood pressure. So it is easy. There is no way out. If a doctor tells you have hypertension, they'll always tell you to come back again, maybe after 2 weeks. They'll tell you to rest. There are things that trigger blood pressure. For example, if you are smoking, if you smoke that morning and you go take your blood pressure, it will be high. If you take coffee in the morning and take your blood pressure, it will be high. If you do exercise in the morning and take your blood pressure, it's high. So the doctor sometimes also understands. So if you explain to them that I just came from a lab, I was doing some exercise and you took my blood pressure, or I was walking. There are some patients who come walking on their way to the hospital. Wakifika tu hivi, because of the long queues, the doctor tells them, ingia haraka, take your blood pressure, it is high. So that if you tell your doctor that I feel like this blood pressure could have been triggered by exercise, then the doctor will tell you to come back again. So that's why we say it's persistently elevated blood pressure. That's what we call hypertension. So it is not just by one reading. So the moment you say, today I had 140, so tomorrow they'll tell you, come back tomorrow, don't exercise, don't take tea, don't take coffee, don't smoke, and we'll do your blood pressure. If it is still high, you are already getting a diagnosis of hypertension. Yeah.
All right. That's for high and low blood pressure. You mentioned something about diastolic and the systolic readings. Maybe you can clarify on them.
I don't know if I can go practical.
Yes, it's better.
Because we have these readings here. For example, let me start. This is what we call a blood pressure machine. And we are encouraging currently, according to the European Society of Hypertension guidelines that were released recently, they are encouraging every household to have a blood pressure machine. It will go a long way in preventing diseases. If you know you have a household, and most of you are above 40 years, just make sure you own this machine. The same way you are owning expensive phones, these machines are not expensive. Although mine is quite expensive, this one is around 12,000, but there are cheaper ones. This one is for a doctor.
Yes.
You can see it is meant to be on a table, but there are cheaper machines. I don't want to mention the companies because I'm not here to market for any company. So there are cheaper machines. So you can ask your vendors to sell you. They range from 3,000 to 5,000. But just like phones, the more expensive it is, the more effective it is.
Yes.
Yeah. So you can buy according to how much you have, so that you can have. The beauty about this machine, when you buy it, it will serve your mother. Even if it's only one family member who has it, you can move around with it. Ukitoka kule Nairobi, unakuja naye nyumbani. You measure the blood pressure of the whole kids when you are having your Christmas.
Yes.
Unatembea tu nayo ukiwapima, and the moment you notice that they have high blood pressure, you refer them to the next hospital. So this is very important. So when we start it, I hope I can get some few memories. So so you can see some few readings for my patients here. So let me go. So for example, this patient had a blood pressure of 169/104. So the upper reading is what we call the systolic. And the beauty about these machines is that they'll tell you.
They indicate.
They indicate if it's systolic, if it's diastolic. So for example, for this patient, already they have high blood pressure. So the machine has told you it is up. So it's pointing an arrow up. So for this second patient, it was 124/83. So 124 is the systolic and the diastolic. So the diastolic is always a lower value for a normal patient. Unless those patients who have heart failure, those are the patients who will now have, they can even have a higher diastolic than systolic. Yeah. So sometimes you can have a patient who is having 104 over maybe 90. I've seen some cases, but they are very rare cases. If you go to a cardiology clinic, then you can see this patient, obviously the pulse was low, 57.
So the most lower digit is the pulse now?
Yes, the lowest digit is the pulse. So you will have 3 readings. That is systolic, diastolic, and the pulse. Then the same, systolic, diastolic, and the pulse. So this was a second, another patient. Now, this machine, I said, is for a hospital setup. That's why it will give you 2 readings at a go, so that you can make your judgments. Yeah, you can set it so that you can repeat the readings twice for a patient. But there are other machines that you don't need to do twice. So systolic is the upper blood pressure, diastolic is the lower blood pressure reading, the lowest is the pulse. Some machines you can find even the pulse is here, just after the blood pressure. It is like a small, and usually the numbers for the pulse are
the size
is quite small. Yeah.
Alright.
So when you want to do the blood pressure readings, you will actually need to put the machine on the table. It should be at the level of...
Should I fold my shirt and...
Sure, you can.
I'm ready to be a patient.
Yeah, because today we want to show people how
the practical side
of it. Yeah.
Okay.
So first, a patient needs to be relaxed. You need to be seated. Like for example, let me show you. So when you come to the hospital, you need to be relaxed. Don't cross your legs like this. You know, there are people, when you tell them to relax now, they do like this. They want to relax. This is not relaxing. When you do this, that's why anytime when you are seated and you sit like this for so long, there is a probability that you may get numbness of your limbs. So the best relaxing position is this. So when you are relaxed like this, at least the heel of your feet should be down. You understand?
Yes.
So it should be down so that you are relaxed. And you should always rest your back on the chair like this. Then your hand should be here for maybe on the table. So for example, if you are a patient and you are coming to the hospital, the doctor does not have a table, you may need to repeat that blood pressure in the doctor's office. Sometimes there are patients who come to the nursing station where there are challenges. There is no space for the doctor, for the nurse to have a table. So anakwambia tu take your blood pressure and you put your hands on the lap. So this one you see already you are leaning down. For a tall person like me, you're already leaning down. So probably this might not give you the correct readings. But if you have a table, it will push your hand up a little bit just to make sure it is at the level of your heart. So the moment you do like this, probably you may get the correct reading. So even what we are going to do right now may not be the correct reading, but probably it is not very high. There are some people usually like coming to the hospital and anakwambia, just take my blood pressure, and then they give you your hand. Then other people prefer again using the hand that is on the side of your heart. Does not make a difference. Any hand can take your blood pressure. If it is this left hand, if it is this right hand, whichever, there is a possibility that it will still give you the normal readings for your blood pressure. But it's always good to take blood pressure from both hands, then you compare. So you want us to do?
Yes.
Okay. So I hope you have relaxed. This relax. Then so when we want to take your blood pressure, we need to make sure the hand fits, the cuff fits your hand. So we make sure that we put it there like this, then we push it up at least 2 fingers. Then it should allow at least 1 finger inside.
Space for 1 finger.
Space for 1 finger. Then we put it not very tight. Then now you relax on your back. Relax on your back. Relax. Then put your hand here. Then you don't fold your hand. You stretch your hand a bit. Don't press your hand in any way. Nowadays we have phones. I saw some other patient, I'm taking their blood pressure, and they have the phone. Then they receive bad news. So the blood pressure will still go up. So make sure your phone is at least, I always tell my patients.
Is that adrenaline or is it just?
Yeah, it's adrenaline. Any message you receive on phone, it hikes your blood pressure. Because let's say, for example, you are just looking at, people tend to relax and they start, as they are taking their blood pressure, they are looking at their phone. Then a message pops up, your blood pressure will go up. So we prefer patient's phone to be on silent mode, or you can give the nurse to hold it for you, not in your pocket, because still it will vibrate and you will be uncomfortable. So we prefer that phone may be placed far away.
So you avoid distractions.
Yeah, you avoid any kind of distraction. So the room should be very silent. So once we do that, we now start. The cuff will press you a bit. It's going to take around 2 to 3 minutes. So the cuff will press you a bit. Then after some time, it will release. Then it will show you the blood pressure. Then the other thing, don't be so keen at looking at the values when the blood pressure is going on. I usually have that problem with my patients. Yeah, mangalia tu. So akiona imefika 200, anasema bas. Because this machine, when it is taking your blood pressure, it goes up to 200 because it is pressing the artery until the artery stops supplying blood down there. So the pressure has to go up to 200 plus so that it can press the machine, the artery. So the moment the artery now starts releasing blood slowly, that's when it starts taking the reading. So you might look at it and see it is at around 200. Then you get worried that is my reading. So again, that will affect you because it will raise your adrenaline. So I always like when you are taking your blood pressure, just relax. Don't look at the screen. Wait for the results. If you look at the screen, it will actually scare you. Yeah. So let's start. I hope you don't look at the screen.
Okay.
Yeah. done.
Ah.
Your blood pressure is good. Can I tell it out to the audience?
Okay.
It is 119/75. That is normal. Your pulse is 44. So your pulse is a bit low.
That's where the problem is.
Yes, but you don't have a problem because you are a young man. So you need to monitor it. It depends. If you usually like walking a lot, sometimes your pulse might be low. But you need to check your blood levels. You need to check your... if you don't need to skip meals. So those are the things you look at. So you can look at his blood pressure. This one was for my previous patient. This is his current blood pressure. So it has written there. You can read it. Okay.
Okay.
So okay means your blood pressure is okay. Some machines talk for the...
They tell you that.
Yeah, there are patients we are seeing who are blind. So there are some machines that talk. They tell you that your blood pressure is okay. Your systolic blood pressure is high. So it depends. As you are going to buy your blood pressure machine, look at the patients you are handling. If your parent is old, they are blind, and you want them to use this machine, it will tell you even if the cuff is okay, it's well fixed, it will tell you. So it depends. When you are talking to the people who want to sell you the blood pressure machines, ask them, my patient is blind, I need a machine that can help me. Just like phones. I believe we have phones that can serve people who are blind.
Yeah, many of them actually have that manual that speaks.
Yeah, so probably the same.
Now, Dr. Now as we are speaking about hypertension, someone has been measured and maybe the blood pressure is high.
Yes.
Around 160, 170 there.
Yeah.
What do they do to handle that or to manage that? And as we talk about that, is hypertension curable?
It is. Just before I got to that, I forgot one thing. This curve should not be placed here. I've seen some people placing it here, especially those people who have, we have some of our sisters and women who have
very huge biceps.
Huge biceps, some of this upper arm circumference. Yes. Yeah, so kwa sababu haitoshi hapa, they decide to put it here. So we have a special machine for the wrist. Yeah, so there is a wrist BP machine.
This is not for the wrist.
Yeah, this is not for this is a mid-upper arm blood pressure machine. So there is a wrist BP machine. So if you want to buy that again, you need to specify. But most doctors don't prefer. When you are doing your blood pressure for the wrist machine, you put it here like this. So most doctors don't prefer those wrist machines, but they can be important. You know, they can just tell you, if they can alarm you, then you go to the hospital so that a doctor can confirm. Yeah. So those domestic readings are not final. We have special machines that can confirm if your blood pressure is very high or not. So don't be worried when you see a domestic blood pressure that is very high. You need to go now back to the hospital and talk to the doctors to see if they can change they can recheck the readings. Yes. So you're asking about what?
You said it's curable for hypertension.
Yes, hypertension is okay. I don't know if it is. I can say it's curable, but it can be controlled because blood pressure is something that when it comes, especially for the elderly people, it is chronic. Yes. So you cannot say today you are healed of hypertension, you have stopped all the medicines, you have stopped the diet, you are eating everything. No. Chronic diseases don't get healed completely, but you control them, you manage them. Because the problem with blood pressure is not all about the numbers. You know, most people, and again, when they get these machines, most people want to treat the numbers. That is the challenge. I think that's why the uptake of these machines in the homes has not been advised by most doctors. Because if a patient does a blood pressure reading for maybe 2 weeks and they find that their blood pressure is normal, you know, the next thing they do, they decide to stop the medicines. Wanafikiria your pressure itashuka. These medicines are like when you are seated on a chair that has a cushion. When you sit on it, the cushion goes inside. Yes. Then when you stand from that chair, it comes up. It's like a spring effect. So when you stop the medicines, your blood pressure goes up. The funny thing about blood pressure is that you can even stop medicines for 1 year and your blood pressure will never go up. It is just normal. But one day, that one single dark day, that you get a stress or maybe something happens, that is the moment your blood pressure goes up. And unfortunately, for most people who have ever used medicines for blood pressure, then they stop. If it comes back again, inakujanga sijui kama shetani. It always causes, yes, it always causes a stroke. It can cause a heart attack. Most people who have had stroke, most people who have had heart attacks, if you ask in their history, I'm saying that because I work in a hospital, I get those patients. Even as recent as yesterday, I had a patient who had a stroke because they stopped their medicines. So don't stop the medicines without the advice of a doctor. And again, when you are taking these medicines, not that you will need to take them forever. A doctor can advise you to stop them for some time if they feel your blood pressure is okay. But you have to walk the journey with the doctor. Another group of people that I usually talk to is the patients who don't take they don't go to hospital. They just take medicines religiously, but they don't go to the hospital. So these are the risky group of people. I met another patient, I was joking with him. The patient started drugs 20 years ago, before even I became a doctor. I'm now seeing him 20 years later. So I was telling him, when you started these medicines, you are 50 years. Right now you are 70 years. So you are taking medicines that belong to somebody who is 50 years. You know, medicines again, when you reach 55 years, we give you medicine according to the clearance of your kidneys and the function of your heart. So a drug like Adalat for blood pressure, if somebody has developed, for example, this person has developed heart failure, you don't need to keep this patient on this medicine. A drug like HCTZ, yakukata nusu, my patients know that. That's why I'm telling them the names, the difficult names. I know they know it. Sometimes it cannot be used for a patient who has a compromised kidney. So you are taking medicines because the doctor tell you, I told you, so you continue taking the medicines forever, and probably those medicines are past your age, or if not, they are not being cleared by your kidneys. And that's why we are having so many cases of dialysis, because people don't come back to us. We have so many hypertension patients. Maybe they started in a private hospital, it was expensive. If you feel you started in a private hospital and it was expensive, why don't you go to a public hospital? And if you feel a public hospital is not satisfying you, why don't you go to a private hospital? Because there are so many factors. Tuko na mambo ya SHA. People feel that they don't have insurance, or maybe SHA is not working. Why don't you use some little money to just go and consult a doctor, na umpelekee hizo dawa zote ambazo umekuwa ukimeza? You ask them, according to my age, according to the function of my kidneys and liver, are these medicines okay for me? Secondly, how frequent am I supposed to be seeing you as a hypertension patient? So those are the key factors that determine the outcome of our patients who have hypertension.
Is there a possibility of someone living with hypertension without them even realizing it?
Yes.
And on that note also, how does it display on a person?
In fact, that's a very good question, my friend.
Yes.
You know, patients who have hypertension nowadays, they don't exhibit any symptoms. Even as we are talking, I might be having high blood pressure and you don't know. You feel very okay, you are the CEO of a company, you are the one who does everything, you are the machine of that company. But unfortunately, your blood pressure is rising slowly. It's a silent killer. So the only way to know if you have hypertension is this machine. A very simple machine, but it's a lifesaver. If you have a heart and you are above 18 years, then you need to visit this machine, wherever it is, if it's in a hospital, if it's a friend who has it. You know, most people, I have seen even relatives of some of my patients who usually buy this machine. Now, napelekea tu wazazi, they don't even test on themselves. So I had another friend of mine, I cannot mention names, but actually, this guy used to bring his dad, who is around 70 years, and was around 50 years. Every time I could tell him, why don't you check your blood pressure? And I said, iko sawa. So one day, he collapsed and died. When they did the post-mortem, he had a blood pressure of 200 over 110 before he died. And he was living with it, and he didn't know. So sometimes we think blood pressure is for our parents, is for our old people. Anyone who is above 18 years, they need to check their blood pressure. They need to know theirs. And that is the only standard way of knowing if you have blood pressure. Just like cancer and then other diseases like diabetes. It does not have symptoms. But at times, you may have the symptoms. You know, I always tell people that God is good. Because the way he made our bodies, they can give you a signal before you die.
Yes.
So those signals come for people who have hypertension before they get a complication. For example, you can develop a headache, a very sharp headache, before you get a stroke. You can develop very sharp chest pain before you get a heart attack. So the moment you start having a headache, sharp chest pain, cough that is not responding to antibiotics, go check your blood pressure. It might be warning you that very soon you are going to get a heart attack. Some patients usually have easy fatigue, they get tired easily. Some patients they have swelling of the limbs. Some patients usually have puffiness of the face and mood swings and mood disorders. So it happens that way when the blood pressure is extremely high. That is when it gives you those symptoms. And if you delay, when your blood pressure has given you symptoms, it might cause a complication. So you don't wait for those symptoms. It is very simple. Just go to any hospital that has a blood pressure machine. Nowadays it is free. In fact, not even hospitals. Our president gave these machines to community health volunteers. So even the people who are in the villages can visit any community health volunteer and they can take their blood pressure readings. Yeah, so it is everywhere. Blood pressure is not like some years back. Right now, even if you want to take your blood pressure, if you go to a chemist anywhere, they'll take your blood pressure. So don't worry that it is high. Now, the moment they tell you that it is high, don't panic. Come to a specialist like me or any other person, ask them. Somebody has told me that I have a high blood pressure. Can you confirm it? If I tell you you don't have it, you will stay another 6 months, come back, or maybe 3 months, come back. It does not hurt you.
Yeah. All right.
Sure.
So that's the way we know about hypertension or high blood pressure. Now, maybe as we wind up, Daktari, what's your advice, or what can you tell the people that have this disease? Especially considering what they fail in. You mentioned that maybe some people have it, but they don't visit experts like you. What can you tell them?
Thank you. It's a very important thing, and that's where my passion comes.
Yes.
I love it when I see people, like I like that mzee who had lived with hypertension for more than 20 years. And actually he met me, and when he met me, I changed his medicine. Actually, one of the drugs was stretching his left ventricle. The heart was enlarging, and the kidneys were getting strained. So when I changed his medicines, he actually saw the values coming down, and he's still alive. Right now, he has lived with it for another 3 years.
Wow.
That is now 23 years.
Yes.
You see? And he's going on. If you look at him, he's very strong. He's a retired mwanajeshi, and he's very strong. You see what I'm talking about?
Yes.
So such patients, people who have hypertension, the first thing, it's all about acceptance. You know, for you to accept to take medicines for 20 years, it is a plus, first of all. Secondly, you have to accept that this journey you will walk with a doctor. It's just like students. You cannot take your child to school in class 3, maybe they pass the, right now we have the class 7, grade 7 exams. Then you just say, my child is clever, they don't need to go to high school. So that is what people usually do. The moment they score a blood pressure coming from 200 to 120, that's when they start celebrating, and they stop the medicines. That's wrong. You are testing your body, and your body might get complications. So you need to come, see the doctor, walk the journey with the doctor, tell them your challenges. If the medicines are giving you side effects, like there are some medicines that cause cough, there are some medicines that usually cause headache, don't stop them. Come to the doctor and tell them, I feel a headache, and it started since I started taking these medicines. I feel like these medicines are causing these side effects. What can I do? So it is the doctor who will tell you, stop this medicine, replace it with this one. Secondly, you have to check your inner organs. Blood pressure has a tendency of affecting the organs in your body. For example, it can affect your eyes, it can affect your heart, it can affect your kidneys, it can even rupture your arteries anywhere, and you get wounds. So if you are walking the journey with the doctor every year, make sure you do some of these tests. Even your cholesterol levels, you need to check them so that if they are high, the doctor can control them. If the kidneys are getting stretched, the doctor needs to look at the medicines. Maybe they need to optimize your blood pressure so that you are able to now control it to the optimum levels that cannot affect the kidneys. So those are the most important things that as a patient you need to do. And accept. There are people who have never accepted. Some have just stopped accepting it because I don't have any other person who has hypertension in my family. So I don't have hypertension. Hii blood pressure ni yako daktari. Mimi sina. Other people say I don't have stress, so I don't have hypertension. As I've said, hypertension, 80% of the hypertension that we have has no known causes. It just comes on its own. Any person at any age can get hypertension. And there is no known cause. You have never smoked, you have never taken alcohol, you don't take meat, you don't take salt. There is nobody in your family who has hypertension. You don't take a lot of nyama choma. And you have hypertension. You have to accept it. The moment you accept it, we control it. Because if you look at the symptoms, the complications, I usually meet many patients in my community who come when they have a complication already. And these patients, they are coming to us when they have a complication. I usually joke with them and tell them, you know, at that moment, you are not coming alone. Umeletwa na mchungaji, bibi ya mchungaji, village elder, wamesema, treat this guy. So you have to accept medicines.
Yes.
But most patients, when they come to me when they are alone, and I tell them, you have blood pressure, they refuse. I meet them 5 years back, wakati wameletwa na mchungaji, bibi ya mchungaji. Now they are telling me, patia huyu jamaa dawa. When it is too late. So let me find you when you are still okay, your brain is fine, you don't have a stroke, you don't have a heart attack. Let's talk. Ask me all the questions.
Yes.
If you feel you are not ready to start medicines, I will accept. You know, Kenya nowadays, we go by the patient rights. If a patient tells you they are not taking medicines today, I tell them, go and come back. We see. If it has not come down, accept. But don't run away. Because if you run away, again, as I've told you, you'll come back na bibi ya mchungaji na mchungaji wanakuleta. And you know it will be too late. So don't wait for that late time before, that's when you are coming to the hospital and already you have a stroke. It really pains me. I want to get people when they are still strong so that I can walk with them this journey of hypertension together. And not that I will keep you on medicines forever. Who knows? If your blood pressure comes back to normal, we'll again sit back and decide. Now it is normal. Can I stop the medicines? And you shift to lifestyle and exercise control alone. And we go that journey again, we see. If it comes back again, we take you back to the medicines. Yeah.
All right. You mentioned about the lifestyle and all that.
Yeah.
Is there a way you can lower your BP without medication in natural ways?
Yes, there is, and I need to clarify that the internet has a lot of things. Please, the moment you read something on the internet, I saw even some videos. These guys are very funny. They have even captured the faces of some of our very senior doctors in the field. even me, some of these days you'll see me on the screen and just know it's not me. Talking about a certain herbal agent and whatever. People are using these AI things to just fix somebody's face, and you feel like, this is Dr. Silas talking, and he is saying you can use these potatoes and guavas to control your blood pressure. That is not me. I know there are alternative ways of controlling blood pressure, but they're just a supplementation to the medicine. They just complement what the medicines are doing. So first things first, a doctor has gone to school to study your heart, to study your blood vessels. For the years they've been in school, so that they can manage your blood pressure. So go to them first. Come to them with all that information. Let's discuss at a round table. We don't fear, because we know we are living in the days of Google and AI. So if you come to me with that information, I will not chase you away, but we will discuss. I'll tell you, now, this is an alternative way of controlling your blood pressure, but it does not mean that it replaces what the doctor is telling you. Because remember, doctors have managed blood pressure from years. Blood pressure is not a new disease. It's a disease that has been there for so many years. In America and the Caribbean countries and many other countries, many people have had hypertension. Africa, I think hypertension has increased from the 90s. But from the 18th century, actually, in these other countries, blood pressure has been there. So you can control it, but make sure you have the advice of a doctor. Secondly, diet is important. If you reduce salt, if you reduce fats, if you reduce meat, that's nyama choma, and many other things. If you stop taking alcohol, if you stop smoking, if you start doing exercise, you are already, all those things that I've mentioned. Like alcohol reduces your blood pressure by around 2 millimeters of mercury. Exercise reduces your blood pressure by almost 10, not 10, but 6 millimeters of mercury. Weight loss, if you lose 10 kgs, it reduces your blood pressure by 2 millimeters of mercury. Evidence is there. The books, there is
BMI.
Research has been done. So if, for example, if they find you with a blood pressure of 200 over 100, and you have a weight of 100 kgs, the moment you lose 10 kgs back to 90 kgs, you have lowered your blood pressure by around 10 millimeters of mercury. So if you are at 200, you are already at 190. So ukiongezea dawa kidogo, you are doing well. So it depends. So lifestyle is very key in management of blood pressure. Plus stress. We need to avoid stress. There are people who take a lot of coffee. Kuna watu wanakunywa chai ya majani, karibu inafanana na waso yao. Very, tunaitanga tikini. So that tikini tea, you need to avoid it. So make sure everything that you consume, just consume little. Little. Salt, little. Fats, little. Everything that you take, just take in little, small quantities. Yeah.
All right. Yeah. I think we've exhausted many of the parts that I would want us to discuss today, and we've reached the end of health, hygiene, and wellness today. We've been discussing about hypertension, how we can manage it, how to know the figures that indicate high blood pressure and low blood pressure, as well as the heartbeat or the pulse. And I'm glad that Dr. Silas has done the practical part, and now we understand how we can manage it. We've reached the end. Maybe, do you have anything?
No, just to celebrate, you know, in May we had the May measurement month.
Yes.
I've always told people, on your birthday, just do me a favor. Check your blood pressure, and before you take your cake, check your blood pressure.
Wow.
Before you go for that party, take your blood pressure. The moment you finish that party, because it will have a cake, the morning after that cake, just take your blood sugar to see if the cake you ate is still in your blood. Yeah. Wow. So every person on your birthdays, make sure you do that.
All right. Yeah. Have you accepted the challenge? If you accept it, write down in the comments. Challenge accepted. Now, it's the end of Health, Hygiene, and Wellness. Keep watching Imani Television. My name is Barasa Saenyi. I've been hosting Dr. Silas Wambulwa, a hypertension expert. Until next time, God bless you. Bye bye.